The staff in legal affairs were really swamped with contracts, and it was taking a long time to get contracts out. This was really affecting the departments in the hospitals because they were waiting on products and services, and this was slowing up their ability to do their jobs.
We researched our process.
Simple, straightforward contracts were taking 3 months or sometimes even longer to get completed, so we tried to find a better, more efficient way to get through the contract process.
The long lead times were really costing us money and opportunities.
We had some ideas.
We formed a team of about 25 people from throughout the hospital to study the problem. We knew there had to be a better way.
We discovered that we were writing a lot of contracts that weren't actually necessary and that a lot of these contracts could be taken care of by doing a simple purchase order.
Children's is a member of Child Health Corporation of America, which is a group purchasing organization. The group purchasing organization, we learned through this process, has several pre-negotiated contracts available to us. By accessing the CHCA contracts, we were able to save tremendous amount of time and efforts because we no longer had to go through the legal process and create our own.
We determined that we should incorporate standard terms and conditions on a purchase order, which is really industry standard. That allows us to send a purchase order out to a vendor and they already have all of our terms and conditions that we would need them to agree to without actually having to sit down and negotiate a contract with them.
We put our ideas to work.
We identified and weeded out the products and services that could be purchased without creating a new contract.
Those were the instances where we used the purchase order system.
By utilizing these contracts that were already in existence through CHCA, we were able to save not only the time and effort, but also money.
We improved our process.
By working through this process, supply chain and legal have learned to work more closely together as a team and to utilize our resources better.
The new process resulted in a 50% decrease in contract requests.
The legal team gained back a lot of time that was tied up in unnecessary contracts. Now we can devote our time to the more complex and higher risk engagements for the hospital.
Our system is now more efficient. Our departments are more satisfied with the process, and we're saving money.